My name's Alyssa Tan, and I completed my thesis under the supervision of Dr. David Priest. My research is on emotion regulation strategy profiles that characterizes loneliness and psychological distress. It is well established that emotion regulation strategies are important in psychopathology, in particular for psychological distress, which has a composite of depression, anxiety, and stress, that the strategies people use to regulate their emotions are important risk factors, and that emotion regulation is useful for the conceptualization and treatment of distress. On the other hand, loneliness, which is another type of negative affect but is unique in that it stems from the subjective perception of one's social needs being unsatisfied and is now a major public health concern, has had not much research looked into whether strategies used in regulating emotions are important for it too. Currently, most interventions for loneliness focus on the social aspect and are not as effective as emotion regulation based interventions such as cognitive behavioral therapy. Considering that loneliness and distress are both types of negative affect, the aim of the study was to examine whether emotion regulation strategies are as important for loneliness as distress, and to directly test how similar or different these constructs are within an emotion regulation framework. This was in the hopes of informing conceptualizations of loneliness, which can then help to determine whether emotion regulation based interventions, such as cognitive behavior therapy, may be relevant in treating loneliness too. Hierarchical multiple regressions revealed that emotion regulation is important in explaining both constructs, with emotion regulation strategies obtaining a large effect in predicting these outcomes and accounted for 44.8% of the variance in loneliness and 39.1% in distress. In terms of individual strategies, loneliness and distress were predominantly similar. As seen on the poster, the values highlighted in orange were significant predictors. That is, lesser use of cognitive appraisal and elevated use of withdrawal, self-blame, catastrophizing, and reminiscence. However, there was some uniqueness to loneliness, such that it was also characterized by greater use of expressive suppression and lesser use of seeking social support and acceptance. This is interesting to note, as the majority of the strategies unique to loneliness had a social aspect to them. A latent profile analysis was conducted to identify which profiles, or subgroups, of emotion regulation strategies characterizes loneliness and distress, and identified 7 profiles. Across these 7 profiles, there was no distinct loneliness or distress profile found. Instead, the different emotion regulation profiles were predominantly similar in characterizing loneliness and distress. Interestingly, Profile 1 had the highest levels of loneliness and distress and largely replicated the pattern of emotion regulation strategies found in the regression. As loneliness and distress were predominantly similar, with emotion regulation appearing to be a common underlying mechanism between them, my findings suggest that a transdiagnostic approach and an emotion regulation framework may be relevant for these affective phenomena, and that cognitive behavior therapy may be useful in treating loneliness too. While predominantly similar, there are emotion regulation strategies that seem to be unique to loneliness and may need to be taken into consideration when assessing and treating high levels of loneliness. Thank you.